Dr. Lance Larson. He is from the Sierra Pacific Orthopedic Center. Is it anesthesiology or doctor of pain management? What do you call yourself?
Nowadays, it would be pain management. Previously, anesthesia for 15 years.
You, as a pain intervention specialist, can offer what?
The four legs of the table for pain management. You've got your injections, you've got physical therapy, you've got pain psychology, and then finally medications. Come to see me, other than likely pain psychology, you're going to have at least those three areas that we're going to look at.
This is KMJ at KMJNow.com or wherever you stream. Welcome to the Marc Kapetan Show. This is attorney Marc Kapetan, your host. Today's show is brought to you by the Kapetan Brothers Law Firm. We've been serving the Central Valley since 1995. If you or anybody you know has been injured in an auto accident, a truck accident, or a motorcycle accident, give us a call at 559-498-8000. Or if you've been arrested or cited for a criminal offense, call the Kapetan Brothers Law Firm any Monday through Friday, 8 to 5. If you want to call on the weekends, I'll answer the phone. So 559-498-8000, Kapetan Brothers. We are the Valley's law firm. Folks, my aching back is the lesson for today. I was hanging out with Russell Harris, the almond man, Marcella, at the Fresno State football game this last week, and I told him that I was having a procedure on Monday and having injections in my back. He said, why a thin little small guy like you needs, why do you have back pain? I mean, you shouldn't have back pain. I told him I've always been small, but I've always carried my weight, whether it's judo against 250-pound opponents, rock and roll, having the sound company lifting 400-pound speaker cabinets with three other big guys, or jumping around on stage playing rock and roll guitar. I've always, in a car accident I had in about 2010, or if it's just the result of aging, my back's a mess nowadays. Whatever reason, I have these aches and pains, and I need an overhaul. I'm sure many of you out there can sympathize, as you are probably going through the same thing. Now, this is not an infomercial for my next guest, and no endorsement is pending, but my friend Marco, who's a professional guitar tech and carpenter, currently part of the Metallica World Tour crew, put me in touch with a friend of his and a doctor. Marco, who's been on his road most of life, knows what pain is all about, and he found someone to help. I want to welcome that doctor because we just went through a little bit. I think the last time I saw you, doctor, I was ass up in your office. So I want to welcome that doctor to the Marc Kapetan Show. He is from the Sierra Pacific Orthopedic Center. He's a doctor. Let me ask you, what is it, anesthesiology or doctor of pain management? What do you call yourself?
Well, nowadays it would be a pain management physician. Previously, anesthesia for 15 years.
Dr. Lance Larson. Welcome, Lance.
Hi, Mark. Thanks for having me.
Thanks, buddy.
Yeah.
Okay, listen, we're going to be talking about rock and roll and all that kind of stuff because I know you love all that stuff. But let's first talk about the business a little bit, all right? Most people are living in pain, and you see them as a result of injuries and accidents, age, genetics. What's the biggest problem you guys have?
I think the biggest problem, the biggest contributor percentage of patients I see is likely just the aging process. A lot of work-related type things, whether it's acute or chronic issues. Give you an example of, maybe you have a younger patient who all of a sudden's got a herniated disc from either at work, at the gym,
right?
Anything, and
stenosis is what?
Narrowing. If you say spinal stenosis, it's a narrowing, let's say, of the spinal canal.
Is it a buildup of the bone that causes it?
It's usually a little bit of a mix of bulging disc, increased thickening of the ligament behind the canal, osteoarthritis, thickening of the joints there at the segment, Yeah.
Okay. See, I always thought stenosis was purely just almost like a pipe, that it's a calcium overload that's thickening, but you're basically stating that there's a lot of anything can cause a narrowing at some certain point, and that's considered stenosis.
Right.
Okay. Ray Appleton, and I'll say he freely discusses it, and I don't know if you know Ray or not from here at KMJ. He has something called ankylosing spondylitis, which is a very severe form of stenosis.
That's more where you just get a really stiff back. The joints of the spine are a little bit more fused, and you have a much less range of motion. That's
okay. You're a rock and roll guy. That's the Mick Mars syndrome, right?
Yes, exactly. Yeah, Motley Crue. Yeah.
Yeah, I mean, literally to the point to where the guy could not bend at all. His complete spine fused totally solid, right?
Right.
And he was still going out there and doing it. Yeah.
Remember seeing them here in maybe 2014. They were here with Poison.
Oh yeah, absolutely. I was there.
Yeah, you were there.
Yeah.
I was pretty close up, and I remember.
I hate to tell you I was backstage, but okay.
Oh, yeah?
So we're going to be, by the way, folks, we're going to be battling rock and roll all day today with Dr. Larson.
Oh, man, nice.
Yes, I was actually. So, let me ask you, how does a guy go through life like that? I mean, he looked stiff at the time, basically. What I mean, obviously he's getting pain management through someone like you.
Right. He's probably, he's probably on some type of meds. Hopefully nothing heavy. Just maybe something more like anti-inflammatory.
It is Motley Crue, so maybe something heavy.
Probably. Yeah, for in case of emergency.
Dr. Feelgood. No.
Physical therapy. He's probably got a home exercise program set up.
But it's got to be debilitating. I understand a lot of the breaks that they would do with drum solos and all that kind of stuff were literally to allow him to go in the back and just rest.
I believe it. Yeah.
Okay. All right. So they come to see you, and you as a pain intervention specialist can offer what?
So at Stanford, during my training at Stanford, we would call it the 4 legs of the table for pain management. You've got your injections, which probably most people are familiar with, epidurals and so forth. You've got physical therapy, which is a big part of all this. You've got pain psychology, which a little bit tougher down here.
I want to talk about that later on.
Okay,
but I
sure.
heard about that.
And then finally, medications. So that's, you come to see me. It's gonna, other than likely pain psychology, you're gonna have at least those 3 areas that we're gonna look at.
Your specialty though is not just pain medications, but not intravenous. Basically, when you say interventional, it means basically injections and stuff like that. Right. Actually, directing the pain management and the medications directly to the source of the pain.
Exactly. You're for instance, epidural injection. We're injecting in your near your spine, near the area that is inflamed, and we're trying to get those steroids delivered as close as we can to that inflamed area in an effort to help decrease your symptoms.
Say you have the injuries, etc. The pain is a pinching of the nerve. What causes the actual pain in and of itself?
So let's say you have a herniated disc. So that disc is going to be very inflamed. It's going to be swollen. It's going to, all the inflammatory mediators of the body are going to kind of converge on that area. And as a result, the nerve root that leaves at that level, which might go down your arm, or if it's lower in the spine, it's going to go down your leg. That's going to basically get compressed.
And maybe I'm misremembering this, but wasn't there a time, can the disc, and wasn't there a time where they were doing something to try to inflate the deflated disc, basically? Is that possible if there's a collapsed disc?
Usually in that case, you want to see a surgeon for get maybe like a disc replacement.
Right.
Yeah.
And I know that's not your specialty, but at some point, when the pain intervention is no longer working, is there a alternative other than replacement of the disc, et cetera? If you're injecting, isn't there something that could be injected into the disc to help expanded again?
I mean, this might be coming down the pike in the future, but I mean, you're talking more like the what we call regenerative medicine,
right?
Where you can potentially inject stem cells, PRP, platelet-rich plasma, which comes from your own blood, and inject that into the area. It's kind of, it is very, that field is, it's got a few years to go. There's not many studies.
My friend, the artist Frank Arnold down in Cabo, is one of his good friends down there, is one of the leading people in stem cell technology, and she even admits it's just not there yet. So,
right,
we're going to be right back with Dr. Lance Larson from Sierra Pacific Orthopedic Center right after this. This is the Marc Kapetan Show on KMJ. This is KMJ at KMJnow.com or wherever you stream. Welcome back to the Marc Kapetan Show. We'd like to thank our sponsor for today's show, Arc Mediterranean Grill. We love the Akisian brothers, don't we, Marcella? Yeah, we love those guys. Arc Mediterranean Grill. If you're looking for some authentic Armenian goodness, go to the Arc Mediterranean Grill. They have mouth-watering hummus, delicious dolma, shish kebab, beef kebabs, Marcella's favorite, the chicken kebab, but she also says now she loves their fries. I didn't know that. That's a thing? Okay. Marcella said go get their fries. Take the office for lunch or the family for dinner. Pick up some takeout. You'll love it, I promise. The Akisian brothers and Arc Mediterranean Grill. 2 locations, one in Fresno and one in Clovis. Arc Mediterranean Grill. Champlain, Shepherd, Herndon, and Armstrong. Please go get some food. All right. I love it. All right. We are back on with Dr. Lance Larson. Dr. Lance Larson is from the Sierra Pacific Orthopedic Center, which I was just visiting yesterday. You stuck me how many times with a needle, Doc? Do you like Doc? Can I say Doc? I know fine. Some doctors like it, some don't.
That's fine.
Okay, thanks.
Yeah, probably 8 times. 4 to numb you up, and then 4 for the actual procedure.
Oh, okay. So what I was trying to describe it to a buddy because I did the manly route and I stayed awake the whole time, right, buddy? Mm-hmm. Yeah, pretty rare, huh? Yes. Tough guys, right? You looked down at me and you said, "God, that guy's a man." Okay, so so by the way, your office staff there, they are great, folks. If you need, and again, I said this wasn't an endorsement. They are so nice and so well trained, but the little notes that they give me at the end, hey, get well soon, this, that, and there, all that is beautiful. Okay, describe when you walk in. Is it just a needle? Is it some sort of thing that's feeding the medication? What are you actually doing when you walked in?
So I walk in. We do a timeout. Make sure we have the correct side and all that kind of stuff, and then we start taking X-rays of your neck, your cervical spine.
Live right there.
Right.
Yeah.
Right.
Okay.
I'm marking your skin to determine the points where I'm gonna place the needles, and once the needles are placed, injecting just a little bit of dye into each one and taking a shot to make sure there's we're in the right spot, that the spread looks nice, and if that looks good, I'm just gonna inject your basically your bupivacaine, your numbing medication, and that's it. And we'll pull the needles and we're done.
And folks, I didn't want to talk about my procedure necessarily, other than to describe exactly the kind of job you do and what do you do. It's a numbing to see if it relieves the pain, which it did. If it relieves the pain, and then potentially an ablation, which is a more permanent numbing or deadening of the nerve that causes the pain in the future, right?
Correct. Yeah, I usually last anywhere from 6 to 12 months on average. Those little nerves do grow back. Those little nerves that go into your joints, they grow back. Sometimes they grow back, but the pain is not anywhere near it was originally.
Let me ask you, why, if we've always heard that nerves don't grow back, how do those nerves grow back and others don't, like spinal cord nerves and things of that nature?
So brain and spinal cord, that's your central nervous system. That tissue does not grow back.
Okay.
peripheral nervous system, all the other nerves that come off and go to every little bits of your body, all different areas, those do grow back.
Oh.
That can be a slow process.
Okay, and so that's why when you do these ablations, it's not a permanent thing. The nerve's going to grow back.
Correct.
Potentially.
Now you could do an ablation potentially with alcohol, and that can be a permanent ablation, but we don't do those down here.
I'm assuming the risk is maybe too great because you may get a unintended consequence.
Right,
basically.
you can get neuritis. Yeah, it's just, I mean, yeah.
You talked about one of the alternatives. I know you're in favor. You're comprehensive. I see you use the term multidisciplinary, right? Mm-hmm. Meaning that you do intervention with medication, but you also are in favor of exercise, yoga, all those kind of things, right?
Right. Any type of low impact activity, really, where you're gonna strengthen your body. Physical therapy, yoga, tai chi, Pilates, walking. Walking is a great exercise, not only to lose weight, but to strengthen those low back muscles that work the hips, etc. Aqua therapy is great. If you've got a pool, I tell my patients walk the shallow end, 15 minutes, 3 times a week. Absolutely.
I'll tell you, the walking, and I used to run it. I can't anymore. But the walking, I stopped when I started having the major pains, and I think that's part of it. People stop the exercise that they should be doing, and your pain becomes more of a neuropathy, or if that's the proper term, it becomes more of a.
It becomes more chronic and becomes more of a detriment to your daily activities and your function level.
Is there a significant portion of people that walk in, and potentially me included, that you sit there and you say, you just need to exercise more?
I usually just don't say that.
I know it's harsh.
Because there is, no, I mean, if you walk in with pain, I mean, there's something that typically just exercising more usually will not fix or help.
You talked about pain psychology. I had an aunt. I walk in one day. She goes, Mark, come over to the house. I said, and she was 80 years old at the time. She had died on the table like 3 times during a procedure in the 1960s because of anesthesia.
Right.
So she refused anesthesia ever since then. I walk in. She goes, I think I broke my arm. And as soon as I see her, I'm like, oh, my God. It was just this look of her arm just hanging down. Another time she broke her finger. And I saw her. The guy says, I'm going to give you anesthesia for the stitches that I'm going to put in your finger. And she looks at me, and I looked at the doctor, and I said, emergency guy, I said, she doesn't need that. And he goes, what do you mean? I go, she's not going to accept anesthesia. Mm. Is there a mind over matter type thing that could happen to where she, drilling with teeth, everything, she never had anesthesia. She would just never do it. And she said it didn't bother her much.
Well, that sounds like a little bit more than mind over matter to me, honestly. That's, I mean, I was an anesthesiologist for 15 years. And, you know, when you study anesthesia, you do 4 years of residency, you learn about, you know, the rare patient that may have an enzyme deficiency or superlative amount of enzyme that may break down or prevent the breakdown of certain medications. And yeah, it's almost like you sometimes don't need what you would think the patient would need.
You're suppressing the pain. They're suppressing the pain.
Yeah.
Is there a study that you have that basically is how do we get a person to not think about the pain and try to work through it when it comes to the exercises, et cetera?
Not so much a study as it's, again, if you go back to that 4 legs of the chair for pain management, for spinal intervention, if you look up the definition of pain, it's pain is a physical and emotional experience. It's not just physical; it's emotional. Everybody has. I mean, you hear, I have a high pain tolerance. It happens. Everybody's different.
That's the emotional response.
Yes, everybody has a different perception of pain. Hence, they're going to respond to pain differently.
Yeah.
That's where pain psychology comes in.
Well, believe me, I just told when she was in front of the doctor, I said, yeah, no mind, no pain, basically. So, okay. Chiropractor?
Chiropractor, chiropractor.
Do you believe,
acupuncture, absolutely. There's plenty of articles in the medical literature that support both all kinds of alternative therapies. Typically I'll basically lay out all the different options and therapies for my patients who, are interested in, maybe doing something alternative to, the.
So you'll work that into the whole process.
Absolutely.
Yeah.
Absolutely.
All right. We're on with Dr. Lance Larson from Sierra Pacific Orthopedic. We'll be right back on the Marc Kapetan Show right after this. This is KMJ. This is KMJ at KMJNow.com or wherever you stream. Welcome back to the Marc Kapetan Show. Folks, Marcella, you know the drill, don't you, Marcella? Have we done this in a while, Marcella? If you have been injured in an auto accident, a truck accident, or a motorcycle accident, who do you call? The Kapetan Brothers, with a big, beautiful smile that she has. Kapetan Brothers Law Firm. Folks, we've been doing this for decades. My brother Peter, I'm going to pot this music down a little bit. My brother Peter is a great attorney. He really is. I think he was second in his class at law school. Yeah. Great attorney. 37, 38 years worth of experience. I got about 35. So if you've been injured in an auto accident or if you've been arrested or cited for a criminal offense, please give us a call. We actually know what we're doing. We're not just guys on the radio. So we know what we're doing. Another guy who knows what he's doing is Dr. Lance Larson. You like that segue, Doctor?
That's excellent.
Thank you. From Sierra Pacific Orthopedic. He's a pain intervention specialist over there. Born and raised in New Jersey, in Jersey City, even though you were just checking the score on the Yankees game.
Yep.
I just outed you there, buddy.
Yeah. Well, we didn't, New Jersey doesn't have its own baseball pro team, so.
Yeah. Well,
again, it was either Yankees, Mets, or there's some Philly fans.
What's closer to Jersey, though? I don't know.
Where I grew up, it's actually about almost even.
Okay.
To get to either city.
All right, I'll forgive you for it then. You went to Brick High School? That was the name of the?
Brick Township High School, Brick, New Jersey. Jersey Shore area.
You don't have an accent or anything, though.
It comes out a little bit if I have a couple drinks.
Yeah. A couple drinks in a White Castle?
Or if I say water.
Water? Is that how it is?
Yep.
Notre Dame, good Catholic boy?
Yeah, pretty much, yeah. Always wanted to go there. My uncle went there, and so I grew up, my dad and I watching the games. So,
what'd Dad do?
He a quality control supervisor at a manufacturing plant back in Jersey.
So he was a Jersey guy. He was blue collar.
Yeah, born and raised in Jersey City, and then moved down to Brick Township with his family in middle school.
Did he say, "There's no son of mine that's going to be a doctor"? Right.
Right. Yeah.
Hey, was he okay with you being a white collar guy?
Oh, absolutely, absolutely. He, he was supporting me whatever I do.
Yeah. Mom?
Same. Yeah. Very supportive. Both hardworking. Make sure I, was able to get to where I needed to go.
Yeah. Yeah. Penn State. You did your residency there. Oh, wait a minute. You went to American University in the Caribbean. Yes. That's got to be the best, right? That's got to be a great life.
It was, a lot of studying and didn't really have any money. So we just had to do the best we can. But you take a test, you blow off some steam that evening, you go to the beach, take a day off or two of studying. It was a good experience.
What island is that?
St. Martin.
Oh, St. Martin.
Yeah.
Is that part of is that a British colony or is that an American colony?
That's actually part of the Netherlands Antilles. It's half Dutch and half French.
Oh, wow.
Yeah.
Good food, good all that kind of stuff?
Absolutely. Yeah, a couple areas on the French side, you would think you're on the French Riviera, honestly.
Really?
Yeah, it was pretty, I
went through the Caribbean a bit, and you go, I forgot where we were right before the Grand Caymans. Then you get to the Grand Caymans, is this beautiful provincial looking place,
Right.
And the rest of it could be sort of a mess. But Penn State.
Penn State, Hershey, Pennsylvania. Yep. Penn State Hospital.
Nice. So. And Stanford. Oh, you finally got out to California and you were at Stanford. What's a fellowship? What does that mean?
So a fellowship is medical training beyond residency, which typically is your 3, 4, 5, 6 years of training for your general specialty, let's say. So typically, I did 4 years of anesthesia residency at Penn State, came out here, practiced for over 10 years, and then I wanted to do something a little bit different. So I was lucky enough to get into Stanford to do a fellowship in pain intervention and pain management.
Right. So you were already out here in California before that?
Right.
What brought you out to California?
I had some relatives that lived up in the East Bay.
Yeah.
I liked the weather.
Yeah.
I'd never really lived out West Coast before. So
you wanted to move to Cali. Yeah. But the East Coast people call it Cali, by the way. No one around here calls it Cali, but they call it Cali.
Exactly. Everybody out here says Joyzy, and no one back there says it that way. So.
You got sort of a sweet thing. And you know what? I got to say it's admirable for a guy who comes from, some of the assistants that work at my office and then go on to be attorneys, I think it's beautiful because they have blue-collar families. And then they go get this college education with no college background with the family and stuff like that. I think it's a beautiful thing. But you went because of your pediatrician.
Right. I was probably just in grade school when I knew I wanted to become a doctor. And part of it was because I really looked up to our family pediatrician, Dr. Foz.
Yeah, which is great for a Jersey guy to say Dr. Foz.
Yep. Yeah. And I knew I wanted to be a doctor someday.
Yeah, I mean, just his bedside manner. What was it?
I think when he walked in the room, you just knew he was the doctor. You know, he had all the answers, and you know he was going to make you feel better.
Yeah.
And he usually did, except on the rare occasion where he would come in and he would give you a shot.
Give you a shot, right? Yeah, well, that's what I was thinking is most kids are just afraid of their pediatrician. Is he still around?
Yes, he's retired. My sister tells me he's retired and he is, he's living back in Jersey.
Did you ever contact him and say, "Hey, look, Doc"?
I haven't in a long time, and I really should.
Folks, I'm going to order you to call Dr. Foz and tell him once again, thank you. I mean, literally, does he know you're a doctor and everything?
He does. Yeah, my mom and my sisters kept him kind of abreast of the situation.
Okay. Well, you know what? What am I saying? Just show him the show. Go on. Hey, folks, by the way, we broadcast these things on YouTube and Facebook, so thanks for reminding me to plug the show. So, yeah, if you want to check out the Marc Kapetan Show, go to YouTube and Facebook and stuff like that, and you could check it out. All right. Hobbies. Reading history novels. What kind of history are you interested in?
I really like military history a lot. World War
What
I.
era? Yeah,
World War II, Civil War. I mean, Middle Ages. Yeah, I mean, all different eras.
The family, we're going to probably go hit up a bunch of the World War II sites this next year. So, yeah, I love that stuff, too. Yeah. You read about I noticed that you visited Crete in Italy, so you were interested in the conquest of the great Greeks, right?
Right. Yeah.
Thank you.
The conquest.
I'm just saying that because I'm full-blooded Greek. That's why I'm saying it. So, chess, fantasy baseball, tennis, softball, basketball, and you collect baseball cards too?
I do. You can...
Since a kid?
Yes. Took quite a few years off there in all the schooling time.
Yeah.
Again, not having much spending cash, so...
How many do you have and what's your most valuable?
Oh, you just lose count. I have too many baseball cards, said no one ever. So that I'm not sure, but
most valuable?
Probably a Mickey Mantle card from '56.
Oh yeah, of course. Yeah, especially from where you're from.
So.
No kidding.
Yeah.
Worth? What do you think?
The Mantle cards probably you could probably find on eBay sold listings for about $5,000.
Yeah.
Yeah. I get a lot of my cards from Mercedes baseball cards here in town.
Yeah.
Bullard and West.
Oh, so you're still trading, doing all that stuff, huh?
Buying and
Is it part of the retirement package? I mean that seriously too.
Actually, I always say I was gonna help my son get through school with.
That's great.
Some of them, yeah. Yeah, so
you're going to be able to part with the mantle card. There's no way.
I think so. I don't know. We'll see if it comes down to
That's
it.
funny.
You know.
We are on with Dr. Lance Larson from Sierra Pacific Orthopedic. We'll be right back after this. This is the Marc Kapetan Show on KMJ. This is KMJ. Welcome back to the Marc Kapetan Show. Folks, listen, we want to thank our sponsor for the show, the Akisian Brothers and Arc Mediterranean Grill. Arc Mediterranean Grill has delicious Mediterranean food, authentic Armenian goodness. They have 2 locations out there, one in Fresno at Champlain and Shepherd, and the other one on Herndon and Armstrong. So if you want some good hummus and dolma and shish kebab and all that kind of stuff, go to the Arc Mediterranean Grill. I promise you will be satisfied, and they are just great sponsors of the show. So we wanted to thank the Akisian Brothers. They've been so nice to us. And Arc Mediterranean Grill. All right, folks, we are back on with Dr. Lance Larson, and we're going to talk about, real quick, by the way, you have a 16-year-old son. What's his name?
Yes, his name is Preston.
Preston. Where's Preston? Is what grade is he? What's he going to do? Is he going to be a doctor like Dad?
We've talked about it a little bit. He was talking about maybe being a dentist, but more recently he was actually just talking about being a radiologist.
Oh, radio, yeah.
So
well, that's good. Hey, that's good. Carrying on the tradition of having that doctor's title. So good for him, buddy.
Thanks.
Shout out to Preston out there. Okay. What you really came here to talk about is rock and roll, right?
Absolutely.
Okay. Here's the quote from the doctor. He tells Marcella that, "Tell Mark I know more about the Beatles than he does." My experience with the Beatles goes to 1970 when we were in Greece at my village house, and playing I Am the Walrus on top of our house for the whole village to listen to. So you tell me your experience, Doctor, with the Beatles.
It really started when I was in, I think it was 10th grade, and my younger sister came home with a biography of John Lennon, 120 pages long. She had to do a book report, and she asked me to draw a picture for the cover of the book report. I was pretty good.
You draw?
Sketch. Yeah, It's been a while, but used to a lot back then. I wound up just reading the whole book in a couple hours, and I was just fascinated with John Lennon and his life story, and started just every so often would buy a cassette tape, and then onto DVDs, and
Okay, let me ask you, without giving away your age or whatever. I don't care if you know, but 10th grade for you doing the book report, had he already been assassinated at that point?
Yes.
Oh, wow.
Yeah.
So you didn't have the experience of him basically while he was. Did you? I mean, you knew of the Beatles, but were you a fan at all?
Absolutely. So I wouldn't say I listened to them much before that. My parents had some old records they would play once in a while. Of course, you know who the Beatles are. I mean, you hear the songs here and there, and oh yeah, it's the Beatles. But I really know them individually as John, Paul, George, and Ringo as just the Beatles. So to actually read a book on one of them, and just kind of learn how he had this sharp wit, and he was at times could be very optimistic. He had his faults.
And very acerbic, very, very rough at times too.
Absolutely, it could be very rough with
which wasn't consistent with the history of what John is Jesus and all that kind of stuff or whatever. I mean, with his peace and love type aura that he had about him.
Yeah.
What's like the most shocking thing, or what's the one thing that you read about because you're claiming you're an expert in the Beatles? No, I'm not teasing. I'm teasing. What's the one thing that really fascinates you about it, or that you remember reading about him?
What would I say? I would probably. I would probably say that he fell in love with rock and roll and Elvis, right? He wanted to start his own rock band, so he did. He wanted to become famous, and he would always say, basically, where are we going, guys? The topmost, the poppermost, and They said that when they were playing the clubs.
Wait, say that again?
People.
What is it again?
So John would say to Paul, George, and whoever the drummer was at the time, "Where are we going, guys?" And they would say, "To the toppermost of the poppermost, John."
To the toppermost
of the poppermost.
Of the poppermost.
Yes.
I've never heard that. You do know more.
Yeah, and then he's like, "All right." So he was just absolutely confident, super confident. He was gonna make it as a rock and roller and have a band, and it was his band, and they did it. I mean, they worked hard for years.
You see, and it's funny because, and that's the first I've ever heard of that, because I just always figured he was going to be one of these guys with the peace and love and stuff that, hey man, it's just all about the music. I don't care whether I become famous or not. But that was his goal. You're saying was to be famous. Well,
him and Paul, if you go back to some of the early interviews, Paul, I think was even the one that quoted, we wanted to write a swimming pool. We wanted to write something where we could afford a swimming. So Can't Buy Me Love, we wrote, and they wanted to be famous to an extent. I mean, they didn't. I mean, and then it became crazy, of course, with Beatlemania and everything. But I mean, they wanted to. That's what they wanted to make their living, and.
It kills me. I remember reading, because I saw that you've gone to Liverpool and London and stuff. I remember reading one of the first songs they were writing. They wrote it in this little tiny bathroom that their mom had.
Yeah, they would
in Liverpool.
I think it was at Paul's house. Usually they would do that because there was better acoustics in the bathrooms.
There was better acoustics in the bathroom, Marcella. So they used to love to sit together and sing in the bathroom.
Yeah,
and
they would just face each other with their guitars and they would sing back, and then
then they just become top of the. It's just crazy.
Yeah.
So you've actually gone back there in your quest to know more about the Beatles, basically.
Liverpool?
Yeah.
Yes. Yeah, I was there about 25 years ago. Took a tour called the Magical Mystery Tour.
Oh, nice.
And they stopped at all the childhood homes and a couple other places, Strawberry Fields.
Yeah. Oh, that's got to be great.
Yeah.
Abbey Road?
Didn't go to Abbey Road. That was probably the one big area that the tour did not go.
Dude.
Yeah, I know.
I told you I did that recording session in Abbey Road with Tesla.
I know.
You got to go.
I'm jealous.
I got to say, you should be jealous about that, because to visit Abbey Road is cool enough, and you should do it. To actually work a whole day session in there was just phenomenal. You just saw Ringo Starr. Come on. He really is the best Beatle.
Yeah, he held the band all together,
Hey, man, listen.
He was the final piece.
Do you have this album? I don't know what, I think it's called The Collection or something like that, and it's basically the song, but it also is like outtakes of them trying to record the song.
Oh, the anthologies?
The anthologies, that's it.
Yeah, I have the first two on CD.
Okay, so tell me, someone comes in with a little bit of riff. Paul spends 2 hours trying to figure out bass line. Now, mind you, the bass lines are great lines that no one would ever think of. I mean, he's a genius.
Yeah.
And then you got, John doing his thing, trying to figure out words and blah, blah, blah. The whole time, Ringo has his part down from the very beginning. He knows exactly what he's great.
Yeah, absolutely.
Where'd you just go see him at?
He was at the Venetian Theater. Actually, reminds me of a quick story. So Ringo told a story somewhere recently interview that the Beatles obviously loved them playing. So John brings him this record one time. He says, "Oh, Ringo, I want you to play the next, our next song. I want you to play the drums like this." They play the record. Ringo's listening, and Ringo goes, "John, those are two drummers on there. That's two sets of drums." And John goes, "Yeah, like that. Play like that."
That's funny, really. That had to be like a Phil Spector thing or something like that with the wall of sound type thing.
Yeah. So that's just it's a great story.
So how was the show in Vegas?
Oh, it was awesome. Great. It was great. Yeah, he's got this all-star band. He's got the a couple guys from Toto, Colin Hay from Men at Work. So they do all the Men at Work hits, the Toto hits, the Beatles hits.
Oh, that's great.
So yeah, it was a lot of fun.
Good for you. Yeah, I finally went and saw Paul by myself. Paul McCartney's show here in Fresno blew me away. The guy's he was amazing. Yeah,
I was there.
Yeah. Oh, you were there too. Yeah. Oh, yeah. Listen, I had a chance. We're gonna have to get out of here, but I had a chance to meet him, and I had to turn it down. I'll tell you the story after the show's over and done with. But you're gonna kill me when you hear this story. So, yeah. And I'm not joking around, folks. All right, Dr. Lance Larson finally getting to what he really came here to talk about. Rock and roll. Forget about all the other stuff. Go home.
Excited like that.
Yeah. Go home and play your guitar. Yeah. Why don't you get that excited about anesthesiology? All right. All right, buddy. I will be seeing you back at the office here pretty soon. So we'll see you next week on the Marc Kapetan Show. This is KMJ. Thanks, Dr. Lance Larson from Sierra Orthopedic Center. Also, to my wonderful, lovely producer, Marcella Solorio Taylor. We'll see you next week. This is KMJ.